Hi, and welcome to Rogers TV COVID-19 special programming. I'm David Shearman. My guest is Dr. Ian Arra, the Medical Officer of Health for Grey Bruce. Ian, welcome. Good to have you here.
Thank you, David. It's always good to be here.
Now, it's been a very, very busy time for you. I'm just watching the various press releases that keep coming out, and everything changes every 24 hours or less.
You can say that again. It's emergency, and it is things evolve and develop quickly. There are many community partners, stakeholders. There's a lot of engagement from all levels, and that's a really good thing. You would see goodness coming out of the community from areas that you wouldn't even expect, that people are in different industry are volunteering to change their industry to produce masks, for example, or ventilators. So you wouldn't expect that industry to actually weigh in into health. As you know, we have 11 cases right now, and there is evidence of community spread in one of these cases. Is that a game changer? It's not. It is expected. We spoke about it. We talked about it on this show a couple of times. That I had no doubt it will go to community spread. The preparation is there. The social distancing measures from the province, from the federal government, from the local medical officer of health, all of it is in place. You look at the way people working together. I've never seen this before. You look at the hospital sector. They're committed. They're doing a top-notch job. The first responders, police, fire, and EMS, I meet with them on a weekly basis. The local political leaders are 100% from my point of view, and I meet with them on a weekly basis, are committed to the health of the public and to ensure a proper response to the emergency. And the public, when you look at where our public is, it is, again, in a really good spot where people are concerned and doing the right thing. You would hear about incidents here and there about people who might not be as concerned or ignoring the fact that there's this emergency, or they might think this is fake news. But it is not unexpected in the middle of any situation that a percentage of people are not going to be taking things seriously. Hopefully with the proper messaging, hopefully from the public themselves to educate their peers, their neighbors, their families. This is, we will get a better response no matter what. Working together on this. We're in it together, and I believe we're going to go through it together. I'll stop here and leave it for a question. I'm sure you have many good questions about the subject.
Well, I'm just going to ask you, you're sounding very positive about this, Dr. Arra.
Well, I am realistic. This is emergency, and many things need to be put in place to best address it. When I see that the commitment is there from all levels, like I look at my staff, and infectious disease team is burning the candle at both ends. My concern is how I can slow them a bit more. You need to take breaks. You need to ensure your well-being. It's heartening when I see it at the community. It is also you see people wanting to volunteer, wanting to send their supply of masks, whether it's an ice cream factory or a different business that deals with masks, and they have it and they want to volunteer to first responders. Bruce Power, I am very impressed. Like, I know there are businesses out there that are dedicated to the community, and I know that Bruce Power has done many things for the community, but when I see the level of response in volunteering almost anything we need, they sent a supply of masks that we distributed. We are in the process of distributing to first responders, EMS, police, fire, to nursing homes. That's an issue to almost every area in Ontario. It's not going to be an issue for us. And, again, thanks for that donation from Bruce Power. It is impressive. So am I positive? Yes, there are many reasons to be positive about this. These trying times bring the best in people and really scratch the surface, and you can tell who's 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 doing the right thing and who's willing to do the right.
Today is the 31st of March. It's Tuesday, and the government just announced this morning a complete first of all, an extension of the emergency declaration until mid-April, and then they also announced that all parks, it doesn't matter where they are, but any parks in Ontario are closed to public use. Do you think that will have a positive effect? I know that down in Toronto, there were some serious issues with people using the parks to congregate and to gather in the nice weather. And well, that's a health risk.
It is definitely a health risk. And, social isolation does not mean we're going to be locked up in our houses. It is recommended when it's safe and there is time for a person to go out for a walk. It's a healthy thing. It's a good thing for our mental health, all of us, as long as a person is 2 meters away from other individuals. There is the other aspects with parks too. People sometimes go on an adventure of an hour or two, and they might fall and injure themselves. And now they held an ambulance that's most needed somewhere else in the emergency. So there are different aspects why closing parks. Luckily, we have a lot of outdoors. If our parks are closed, we still have a lot of outdoors to utilize and enjoy, or try to lessen the stress of the emergency through walking around.
And we're all experiencing the social distancing and things like in grocery stores. I noticed the volumes are less. They're controlling the number of people in the store. Some grocery stores have shields in place now to protect their working staff. Reusable bags used to be a big deal, but they ask you politely not to use your own bags, just to put them away. You must use their bags. And these are the changes that we're dealing with.
And it's all good practice. In the health unit, we have a team working on communication about different issues that the public is asking for. And it's probably worthwhile mentioning a couple of them just to reassure the public about these aspects. There's a repeated question about insects and mosquitoes. Is this disease going to be transmitted through mosquitoes? We're coming to a summer season, and the answer is absolutely not. Coronaviruses are not vector-borne. They do not transmit through mosquitoes or any other insects. People can rest assured it's not like Lyme disease. The bug's going to crawl on somebody or their pet and be exposed. So there is a communication coming out from the health unit to different through different outlets. And again, it's worth mentioning here. The second question is about mail services and packages. Is there risk with transmission? Anything international is going to take more than 24 hours to reach the destination, and it is known that this virus would survive on paper surfaces up to 24 hours. However, there are no reports of transmission through mail or touching paper surfaces, and that's from different perspective. Any package that's coming internationally from any country out there that might have higher level of the disease, it's going to take more than 24 hours to reach Canada, so that's not a concern. For local mail, again, there are no reports of transmission. However, to be complete, we cannot rule out the risk 100%, no matter minimal it is. So it is better practice to do certain things. Instead of getting your mail from the mailbox every single day, just leave it till Sunday. So you would know the mail that came on Friday had 24 hours sitting in the mailbox. You collect it on Sunday. Wash your hands before and after. And there are certain recommendations coming out from the health unit to the public and to the post services. Most of the post services have their own recommendation to wash hands and be careful with the transmission.
Well, I also noticed that Canada Post has requested people to clean their mailboxes, just wipe down their mailbox surfaces and to wipe down any railings that might be in front of their house or they're in their apartment building, and just keep that area sanitized. And I think that makes a lot of sense too. We're very fortunate that our postal system has been able to continue delivery over the last month or so, and I'm sure they will continue as long as they can, but it's certainly something to think about.
Definitely. There are other recommendations. Again, people can look at our website, and we're going to be distributing through different things. Switching to electronic bills instead of paper bills probably is a really good idea in general and during these times specifically.
And using electronic funds transfer and those kinds of things as well to pay your bills.
That's right. Using credit cards instead of cash is another thing. Cash is known to be a vehicle for transmission of many things.
Mm-hmm. What other points or key points do you want to share at this point, Dr. Arra?
So I wanted to mention something I believe I mentioned last time we spoke about visitors to Grey Bruce and people from Grey Bruce visiting other areas. It is emergency time, so any non-essential travel really should be on hold until after the emergency. Having said that, many people have secondary residence and cottages here. They are entitled to be in their residence. If they wish to come here, just the recommendation is please do not go back and forth multiple times. This is unessential travel. The same thing goes to our residents. They might have cottages somewhere else, and although it might make sense to go and recharge, it is not the proper time. Any action that we can forego to reduce transmission will save a life down the road. So just again, the message to everybody, non-essential travel, to abide by these recommendations. They have been put in place for a good reason. People who came to Canada in the last 14 days, again, there is a quarantine under the Quarantine Act. There is an order from the federal government, and there is a local order from WH to stay at home 14 days, completely stay at home. This is essential too.
That means they don't go out walking, do they?
They shouldn't. They shouldn't. This is different from self-isolation. Self-isolation, you stay home as much as you can or go out and keep distance, and both of these things are proper. Under the Quarantine Act, there's an order to stay home for 14 days. This is, again, when it comes as an order, it is for a good reason. People need to abide by it.
And the penalties are significant.
I suspect so. I didn't really look into the fines or the level of penalty, but an emergency measures need to be taken.
Yeah. Well, Dr. Arra, thank you for your time today. I know you're very busy, and if there is anything more you need to do, you want to communicate, we're always here. All the best, and thank you to all your staff.
Thank you, David. Stay well, stay healthy. Take care.
And wash your hands.
And wash your hands. I do believe what's going to flatten this curve is nothing but what our mothers and grandmothers taught us. Wash your hands, wash your hands.
Okay. Thank you again, Dr. Arra. Stay safe.
Take care.
And thank you, friends, for being a part of this special coverage of COVID-19 by Rogers TV.